Testing is a huge part of getting the coronavirus under control, but that isn't happening nearly enough here in the U.S. Here's NBC News medical contributor Dr. Natalie Azar on MSNBC earlier today.
I just tried to get a patient tested an hour ago, and I couldn't in my outpatient office.
In your opinion, that person should have been tested?
I would have liked to test her.
Meanwhile, scientists at the University of Pittsburgh Medical Center are racing to develop a vaccine right now. That lab is one of just a dozen in the U.S. working with the live virus to come up with a solution. NBC News medical correspondent Dr. John Torres, live from the lab. Dr. John, I'd love for you to tell us about where you are. I lived for years in Pittsburgh. I know what a wonderful system the University of Pittsburgh Medical Center is, the great work they do there. Tell us what they're doing.
And it's a great system, you're right. And right now I'm at their Center for Vaccine Development, and this is a fantastic area here because they have these 10 facilities that are highly secure facilities where they test a lot of agents. These agents are viruses and other things that cause disease, can cause some people to die, unfortunately, but they're in such secure laboratories we can't get in there without special training and special equipment. So we're watching what they do from outside inside, but it's pretty fascinating. This is also the same facility where Dr. Salk developed his polio vaccine back in the 1950s, and that has saved millions of lives. And so we're just, again, here just fascinated by what's going on.
So talk to us a little bit about what it takes to create a vaccine, particularly create one quickly, because we know they're kind of racing against time here.
And I'm going to talk to the expert here. It's Dr. Paul Dupré. He's the actually director of the Center for Vaccine Development. You told me earlier it takes time and money to develop a vaccine, and we know that's important. But there's a lot of work that goes on here as well.
It takes time, it takes money, and it also takes facilities whenever we're working with an emerging infectious disease. So this is a BSL-3 level containment facility, and you can see the colleagues of mine working away on this BSL-3 virus.
And this is the coronavirus. In some places it's active. This is inactive coronavirus, and this one in particular.
Well, they have inactivated the virus. So what they're doing here is they're determining how much virus that they have been able to grow. They've been able to determine whether or not the antibodies that they're working with have neutralized that virus. So all of this is the work that was done earlier on in the week, and then this is them checking and determining whether or not those experiments have been successful.
So this is not a simple process.
No.
Where it can be done overnight, and this can be developed in a few days or weeks or even months.
No, biology is not fast. If the virus takes 1 week to grow, then the virus takes a week to grow. We can't make it go faster by talking to it. We just can't make this happen any quicker than the biology, and that's the challenge with working with a virus. The paradox of being able to generate any antiviral or any vaccine is the first thing you have to do is grow the thing, and that's why this part of it's very important.
And this coronavirus you actually got from the CDC, and they said this facility is such a good facility, we want you involved in the research. Here's what we need you to do. Here's the material.
Yeah, well, this is one of the regional biocontainment laboratories that have been set up by the NIAID. And NIAID have supported a number of these facilities right across the country, and this is our mandated purpose. This is why we are here. We need to maintain a cohort of very well-trained scientists, and 2 of them you see working away at the minute. They have to be ready and responsive whenever something comes along. The term that we use is disease X. And the coronavirus, the novel coronavirus, as it used to be called, that causes this COVID-19, this is a really good example of disease X, something that we could anticipate, something that we did not know the name, something that we need to be ready to work with, and this is why we are able to become active very quickly.
And Allison, that's why you're seeing so much that it takes years,
right?
At least a year and a half, if not more, to develop this vaccine. It's not something that's going to happen overnight. A lot of work and effort goes on behind the scenes.
I know anytime, Dr. John, we hear any updates, whether it's Dr. Fauci saying how they're doing on a vaccine, people kind of get a little bit excited thinking, oh, maybe there'll be news, but it is something they keep reminding us takes quite some time. I want to ask you something a little different. We saw some news out of Seattle earlier this week that they had a coronavirus test, but they could not use it because it didn't have FDA approval. What's the process, can you tell us, for getting tests approved by the FDA? And do vaccines have to go through a similar process?
So the FDA is the entity that tests medicines, vaccines, therapeutics, and the tests as well. And in this case, they have specific tests that they have approved, and they send them out. They can also have emergency approval of some tests, and that's what they're looking at now for the coronavirus test, because they need a lot more of these tests across the country. And that's been one of the complaints and one of the criticisms a lot of people have lobbied, is that right now this test is going through this cumbersome process, so they're not able to get it out as quickly as other countries have, and that means we're lagging behind a little bit. Same with vaccines. That's one of the reasons a vaccine takes a while, but it's for very specific safety reasons. They want to make sure that before they put it in a human, it's been tested in animals for the most part. And then once it's tested in humans, it continually gets tested to the point where they know it's safe, they know it's effective, and then it can get to the point where they can mass produce it and then get it for the population. But until then, number one, they have to grow it in facilities like this and test it and develop the vaccine, and that takes time.
Dr. John, absolutely fascinating to see the work that they're doing there. Thanks so much for taking us inside and giving us a look.
You bet.
Joe Biden delivered a coronavirus address this afternoon, just a day after President Trump spoke from the Oval Office. Biden released a roadmap for fighting the spread of the virus and future global threats.
The core principle is simple. Public health professionals must be the ones making our public health decisions and communicating with the American people. Public health professionals. It would be a step toward reclaiming public trust and confidence in the United States government as well, toward stopping the fear and chaos that can overtake communities.
NBC News correspondent Mike Memley joins me now. He was at Biden's coronavirus address in Wilmington, Delaware. Mike, Biden had this on his calendar before the president spoke last night. But did Trump's address change Biden's approach at all today?
Well, it certainly played into what the Biden campaign was hoping to accomplish today, frankly, Allison. They couldn't have really asked for more from the White House in terms of gift-wrapping this opportunity for Joe Biden to do what really they've wanted to do all along in this campaign, which is present to the public, to voters, a side-by-side comparison of what presidential leadership looks like now under Donald Trump and what it would look like under Joe Biden. And so I think he was always going to give a fairly policy-oriented public reassurance speech, but he also probably did have an opportunity to get more into the political realm, given what we saw from the president last night. Biden ended his remarks by talking about how I will not lie to you. I will always tell you the truth. But he really wanted to give the public a sense of what he would do as president in handling a crisis like that. Let's take a listen to some of what the vice president had to say in the hotel behind me.
We will lead by science. The World Health Organization now has officially declared COVID-19 a pandemic. Downplaying it, being overly dismissive, or spreading misinformation is only going to hurt us and further advantage the spread of the disease. But neither should we panic or fall back on xenophobia. Labeling COVID-19 a foreign virus does not displace accountability for the misjudgments that have been taken thus far by the Trump administration.
So another thing Biden was able to do here, because not just is he running for president, but he served for 8 years as vice president, was point back at his experience in this issue. And dealing with the Ebola crisis was something he specifically talked about. That office, dealing with pandemics, was something that was centered in the West Wing and was run by his former chief of staff, Ron Klain. So opportunity here at a moment of national crisis, Allison.
Mike, some key points or key takeaways from Biden's plan, things that people should know, the highlights of what he said?
Yeah, it's interesting. When they, as the vice president was giving his remarks here, the campaign released what was more than 20 pages and 7,000 words. That was what they said was his plan to deal with this. And there are sort of two buckets here. One is dealing with the economic fallout of a crisis like this. Right. And then the other is obviously the public health situation that the country is dealing with. So they include things like ramping up and expanding testing, which is obviously a big problem right now here in the U.S. We just don't know how the scale of the problem right now. They would also surge resources, medical resources, protective resources to first responders, to emergency workers, and to vulnerable communities. Obviously, the economic component of this as well. He would send federal funding, make it available to state and local governments to deal with obviously shortcomings that they're going to see in their budgets, and also do things like expand unemployment emergency insurance for people, especially in the gig economy. So just a range of things that Biden would do that he says. By the way, the President Trump is welcome to take his plan and use now. That's one of the points he made here today.
Mike, both Joe Biden and Bernie Sanders have started canceling campaign rallies over coronavirus concerns. It's one of the reasons we've seen you in D.C. for the past couple of days. How is the global health crisis changing Biden's campaign strategy, besides keeping you closer to home?
That's right. We like that for sure. To be honest with you, Allison, we still don't know what this is going to look like in the long term, because the campaign is taking this day by day. We know that Biden was supposed to be in Chicago tomorrow. What are they doing instead? He's going to, from his home in Delaware, have a sort of teletown hall directed towards Illinois voters. The same is true on Monday. We also know he was supposed to fly to Arizona for that debate this weekend. He's going to be doing that instead in Washington with Bernie Sanders. So still having the debate, but doing it in person in D.C. And then from there, the campaign really isn't sure. Tuesday is going to be another big election night. We don't know what the voter turnout is even going to look like, and whether Biden can have an event like he did in Philadelphia the other night. So this is obviously uncharted territory, and the campaigns are going to take this day by day. And in the absence of being able to campaign, you'll see a lot more probably of what we saw Biden do today, which is frankly try to look like president and look for opportunities to be presidential.
Mike, a lot is uncertain, but it looks like one thing is for sure. You may spend nearly a week sleeping in your own bed, which is something we haven't heard from you in a long time.